Now, speaking of partnerships for the goals, allow me to introduce you to my guests this morning. I have 3 guests in studio, and I'll start with the lady that's closest to me. She is Gladys Mwelu Malelu, the Executive Director of Trickle Up Kenya, a CBO that works on empowering young women. Sitting next to her is Collins Osewe. Collins is the founder of Chanjo Plus. He's a budding social entrepreneur who believes that technology can play a critical role in bridging the inequality gap in child health, especially enabling last-mile access to life-saving vaccines for the poor and most vulnerable communities. Chanjo Plus focuses on vaccinations for children aged 0 to 5 years, and Collins has also created an app that replaces vaccination cards and sends reminders to parents. Collins is passionate about creating community change through social entrepreneurship and could talk extensively about health issues, which we will be talking about. And in this effort to attain the Sustainable Development Goals, we have just 10 years to go. You know how we'll leverage technology in that pursuit, and hopefully you can take us through Chanjo Plus. We can walk through that particular app. Also in studio with me this morning from the United Nations, it's Dr. Medine Sehai. Sorry, please remind me how to pronounce your second name. Correct. I do correct? Yes. All right. Who was appointed the UN AIDS Country Director for Kenya in July of 2019. Happy to have all of you present. Now, I'll start with you, Collins. We talk about human capital. Usually we look at 2 factors. We look at health and we look at education. When we look at one of the measures of how a society is faring in those 2 respects is, for example, stunting. Right? And the taller you are, it said that the more income you'll generate moving forward. Yeah, that has been demonstrated. But of course, that measure, it's just a measure of stunting. Meaning if your children are healthy, they'll grow normally as tall as they were intended, or God intended them to be. So why, first of all, how did you get involved in the health sector and with Chanjo Plus specifically? Yeah, so thank you for having me. So in 2015, I actually volunteered as a community health volunteer. My role was basically moving to households, identifying children, and giving them polio vaccine. And for me, what I was startled by was the fact that the inaccuracy of the process, you know. So there's no way we can put faces behind numbers. We could say we have 80% coverage, but how do you know who the 80% are? You know, do we know them by names? Do we know where they live? Do we know who actually issued them the vaccines? And do we know where they get vaccinated from? So that is how Chanjo Plus was born. And then we went into the healthcare systems, and one of the challenges we also found out was the manual reporting, and of course with staff shortages, you have issues around, you know, how do you track children for immunization where mothers keep moving from hospital to hospital. You have issues around, you know, how do you report consistently? What is the quality of data? Is it questionable data, you know? Can data then inform monitoring performance and even overall scalability of immunization systems, basically? So that's how Chanjo Plus was born. So since then, we've been able to roll out in 5 clinics so far. We're about 14,000 children, and 2020 is looking very, very pretty good. We're looking at Busia County, 100,000 children to go. And yeah, so I think basically that's basically the growth path for us, ideally. What has the reception been? So basically, Chanjo Plus, from a design concept, we designed it from a co-creation perspective. So we looked at, you know, how do healthcare workers inform the design? How do health managers inform the design? So we had focused user groups for health workers, community health volunteers, health managers at that point, and therefore the reception was from the conception part of it. So the health workers were involved in the design concept, and I believe so far so good. We only need to, you know, around our working relationship with the Ministry of Health, the NVIP, basically. The reception I mean with Dr. Tab has also been very great, so looking forward to a great partnership going forward. Okay, so tell me something about the app. Who uses it? Is it the healthcare service provider, or is it the mother? That's a great question. So, and that's what sets us apart ideally. I mean, so many people have apps, but Chanjo Plus, first of all, runs on USSD. So that means with or without a smartphone, you can access it. You don't need internet to access it. But in terms of the users, basically, we have a component for community health volunteers that is used for registration of children at the community level. We also have a component for health care workers at the facility level to be able to update immunization updates for children. And then we have a dashboard for reporting where managers or the Ministry of Health can be able to look at
immunization performance monitoring real time, so that they don't need to be able to call the clinics to be able to bring data to them at the end of the day. You know, we can be able to view real time in terms of per minute, per hour, you know, within a duration of timeline, what is the performance of immunization, how many kids get vaccinated, how many are losing out on immunization, and basically, yeah. So we have users across the board. We actually have created value, you know, around the ecosystem of immunization generally. Yeah.
Okay. All right, Gladys, I'd like you to come in at this point. Now, you work on empowering young women. Yeah. And something that came out of the Goalkeepers report is that, first of all, where you're born greatly determines your future. Second of all, no matter where you're born, your life will be harder if you're a girl. And also, as I said, the human capital components will help. You also look at education. Every additional year of schooling, I think, can add up to 10% of your future, can add 10% more to your future income. So have you found that to be true?
Yeah, I can say, first, gender affects all categories of life. And where we are born has a lot to do with our future. If we are not careful with dealing with issues of the past, we end up living crushed and succumbing to issues of gender. Yeah.
All right. So have you experienced that?
Yes.
And how did you come about founding Trickle Up Kenya?
Yeah, Trickle Up was found by discovering who I am, because I went through a lot of gender issues, and before I discovered that it was the gender that affected me, it took me a long time. It was a real suffering. But right now I can say, having known what is gender and how it is affecting like millions of girls in the globe, I think it is a good thing for a girl to be educated, because one of the things that affected me so much, it was that I had little education. And running into early marriage and all these issues, it really affected me badly. Yeah, and I think Trickle Up came about by understanding all this and starting an initiative that will empower the girl child.
Okay, who does Trickle Up cater to?
Yeah, Trickle Up caters to the young girls, 24 years and below, who are really affected by issues of early marriages, and gender, lack of education, and all that. Dysfunctional families, that is a place where gender puts its roots to maybe, I can say, destroy majority of the girl child.
Okay. Yeah. You work with, among other organizations, Plan International.
Yes.
How do you go about that collaboration?
Yeah, Plan International was one of the key organizations that came into Trickle Up, because it really merged with our goals and objectives, and it has really done a great job to Trickle Up. Personally, being capacity builded, growing in my personal development as being a key thing, to even trickling down to the community that I'm serving. And in fact, like on 17th of this month, we'll be graduating over 600 girls and around 500 boys, yeah, within Embakasi.
All right.
Yeah.
All right, so for those who are worried that the boy child is being left behind, can take comfort in
they are not left behind.
Dr. Midin, you're the country director for Kenya. How is Kenya performing on that front? Because one of the indicators for how we are faring as far as the Sustainable Development Goals are concerned is health. Now, based on the Bill and Melinda Gates Foundation report on Kenya, we've shown progress. Is that the case?
Yeah, okay, thank you very much. First of all, thank you for having me here. Greetings from the UN family. When we look at the Sustainable Development Agenda, as you know, we have been implementing for the last 5 years. When we look at the SDGs, you know, they are very transformative to start with, and they focus on 5 major areas. If I may say, in fact, we say 5 Ps, the letter P. One is people-centered, then it's about our planet, it's about prosperity, peace, and partnership. So nowadays, unlike in the MDG era, there is no difference whether we are poor in Africa, in Europe, in America. So the SDG concerns everyone. So it's for everyone by everyone. That's number one. Then secondly, of course, you know, countries are at different level of progress because we have been 5 years into it, and we are left now with another 10 years. So how do we indeed measure whether we are making progress or not? First of all, it's the data collection aspect. So data, mostly we focus on government institution, but it's not like that. You know, private sector, NGOs like my brother and sister have been demonstrating here. You know, there is a lot that is being done even at community level. So it's very important to capture all the data that is happening at country level. But based on the limited, you know, assessment that has been made and the report that you were referring to, the goalkeepers report, I think Kenya is really on track towards achieving the SDGs by 2030, because we hope and we expect that countries in Africa we report that indeed they transformed, you know, the lives of people, leaving no one behind, no matter where we are born, you know, what facilities were accessible to us. I think that's where now, you know, we are addressing the inequalities, not only among countries, but even within countries. Because if you look at Kenya, yes, nationally, I think excellent, the 15th, when we compare within Africa, but how do we look into the various counties? Are we, you know, homogeneous? No. So that's why now we need to look at who is left behind, where should the investment go, and then how to make sure that all the vulnerable and disadvantaged communities also get access. And in fact, I want to mention that the commitment, I mean the political leadership, I think, I don't think Kenya has the best time than now to indeed, you know, exploit, you know, make use of the political commitment that we have at the highest level. We know His Excellency, the President, has launched the 4 big agenda for development, which are in a way, you know, addressing in an integrated manner, and then support the improvement of the Human Development Index, which is around 0.52 for Kenya, which is really a good progress. So I can say, you know, yeah, we have the momentum, but we need to make sure that, you know, the urgency, and then, you know, build on the momentum that we have. So yeah, there is quite a lot of progress in Kenya.
Okay. Now, the report identifies also some areas that need to be looked at. Among them is sanitation. It also looks at, apart from sanitation, it also talks about food security, which, as you rightly said, is part of the Big Four agenda, saying that is something that Kenya is not too well in. So food security, and something that could be exacerbated by climate change. Climate change and factors. So there is food security, sanitation that needs to be looked at, and also the report states that there has been a resurgence in malaria. Now, speaking of inequality, Collins, you were in New York. What stood out for you at the goalkeepers event?
Yeah, so for me, the goalkeepers event, what stood out for me really was, you know, seeing everyone in their little way doing, contributing to the goals, basically. You know, I mean, that was a congregation of almost all nationalities. When you listen to what everyone is doing, from political activism to using music to create change, to, you know, health projects, education projects, basically, towards contributing to the goals, I think that really stood out for me. And also there was a panel discussion on bias, you know, that really intrigued me as well as a person, because I mean, we each have our own prejudices against, you know, how we look at things, how we view things. And so I think the goalkeepers event for me really was an event that everyone should have an opportunity to attend, ideally, and yeah, be part of.
All right. With this data that you've been collecting, have you witnessed this geographic inequality? You said you work, is it pilot? Okay, you have the app.
Yeah.
I don't want to say piloted. Yeah, you passed the pilot stage.
Right,
but in how many counties?
So one county, Nairobi County, so far. We're moving to Busia County next year. Yeah, so the entire county, Busia. Yeah.
Okay. Yeah. So even within Nairobi County, have you witnessed this this geographic inequality?
Yeah, I mean, when you go to hospital, there's certain facilities with, you know, one nurse doing the entire process of immunization management. When, as a mother or a caregiver, you come to such a hospital, really, what would prevent you from getting immunization services is not the fact that we don't have vaccines, or not the fact that you actually do not know what immunization is, but the fact that it's a very long queue, you know? So long queues, how do you manage that? How do you, you know, encourage people to come and do batches that are very sufficient or efficient for them to be able to manage their time? Because we have mothers who are busy, we have mothers who are changing locations, you know, so there's a lot of disparity in terms of the gaps, ideally. What we've been able to demonstrate from the data is we might have official reporting in terms of the ministry data, but when you look at performance, for instance, I'll just give you one scenario, target setting for hospitals. So a hospital like Kibera South Health Center was given, for instance, 128 children. target per month. But then due to the demolition or the construction of the southern bypass, a lot of communities or people moved from that area. So when they were underperforming, their performance was still being based on the initial target that they were given. What we've done as Chanjo Plus on this app is target setting has been automated, so that when we're able to monitor, how many mothers have moved from a facility to a different facility and be able to report on the actual target for that particular hospital. And that should be able to show us some trends, really. So the trends we've been able to get shows a lot of disparity, even in terms of just basic access to immunization services, ideally. Yeah.
All right.
Yeah.
So Collins spoke about how when he went for the goalkeepers event, he met all these people who are making differences in their small way. In a big way, actually. So Gladys, you're one of those people. What propelled you to move from Serikali Nisaidie, which, Kenyans love, from Kenyan Serikali Nisaidie to saying, okay, what can I do in my community to make a difference?
Yeah, thank you, Olive. Yeah, I know I have so many experiences, and one of the experiences we were discussing the other day, it's about now what you are asking. I have so many stories of girls and young men who come around and we discuss in a class of leadership with a difference, and I ask them, why are you idle? Why are you looking for somebody to give you something or somebody to employ you? And it's like, hakuna pesa, we have nobody to employ us, we have nothing. And I ask myself, are we not thinking to come up with something that can bring some income for us, even without looking for people to employ us? And it's like, it remains a mystery. I don't understand. I'm doing a lot of analysis and research to know why is it that people feel like we are powerless. We cannot do something that can bring some food on the table. Like me, for instance, when I started doing the tailoring part, because that was the initial door that God opened for me to run this organization, I started doing the very simple things, like making simple mats from waste products that cannot be of any expense or it requires some money to buy, something that is very small that can help you get some, even 100 bob, something that...
Like what, for instance, when you say material that will not cost too much?
Like the waste product of pieces of materials, you go to the tailors and collect those pieces and do some mat making. That is has no costs because you are given for free. In fact, it is a waste. They throw it. And you make something that is very beautiful and you sell. You just look at the market or the people you are going to sell to. There are people who love natural things and who love beautiful things. And it's like, now, I don't understand, especially the target group that I'm working with. It's like there is a lot of apathy. There is a lot of ignorance, and I think for me, I had to start at that small part. Though it took me time to empower myself with the skill, but immediately after I finished the trainings, I started doing something by, in fact, bringing only one machine to train one person who paid me for that. And it was like, I'm just executing the skill that I already got, which I was not very sure about it. And by, I realized there was a lot of creativity in me, and I can say that is what I'm really giving the girls today.
Okay. With
a lot of talking to them and just encouraging them. Yeah.
Okay.
I think maybe just to add something. I mean, the sustainable development goals for me, I look at it from a point of, until we realize that everyone has a role to play, then that is the time we'll achieve these goals. But if we leave people behind, I mean, whoever, wherever, I just had a very interesting conversation with my taxi driver on the way to the airport. So I was talking on phone about the goalkeepers event, and then when this guy dropped at the airport, he asked me a very funny question, like, which football team are you a goalkeeper to?
I got the same question when I posted pictures on Instagram.
Exactly, Yeah, so I told him, what, this goalkeeper's issue is not about a football team. This is what it is. And then in his own way, he ended up checking my email address and he told me, you know what, I have a welfare society in Pakistan that I'm currently working on. I wish that you could give me more information that I become a goalkeeper at the end of the day. So I hope to see him next year as a goalkeeper. That was so interesting. So we need to engage everyone. No one needs to be left behind. I mean, the Mama Mbogas, the people who push handcuts. Even in terms of designing of our roads, we need to have them have their ideas incorporated in terms of design, so that everyone is on board. We believe as Chanjo Plus that one of the issues you're solving is accurate identification, because we don't believe that you can leave anyone behind if you don't know who everyone is. So that's why even with the first component of Chanjo Plus is the accurate identification bit, where we're able to know who every child is, and then we're able to track what vaccines they get, at what point do they get those vaccines, so that when you say we left somebody behind, we can be able to showcase and verify that indeed this person did not get these services and therefore they're left behind. Okay. So until the point that we get to know who everyone is, we may not say we've left anyone behind.
All right. Dr. Medin, I'll come back to you, Gladys. I know we didn't quite finish with you. But Ethiopia, in the Goalkeepers Report, has been highlighted as one of those countries where remarkable progress has been made, particularly in the healthcare sector. And they cite the community healthcare workers. What can we borrow from that setup? And what change has it made to the communities in Ethiopia?
Fortunately, I worked for the Ministry of Health as Chief of Staff. So one of the flagship of the health sector has been the Community Health Extension Program. So what that does is basically it's focusing on primary health care. As you know, many of the communicable diseases, in fact, that time in Ethiopia, almost 80%, 85% of the the communicable diseases were addressed at that level, and the burden at higher levels were much less, basically. So I think one of the critical success or the factors that have contributed to its success is leadership and ownership, the political leadership, the commitment. Because that time, the late Prime Minister, when he introduced the community health extension workers, at grassroots level, who are identified from the community, meaning they are part of the culture, they are very familiar to the community, they are very well received. In fact, they were female initially. Yes. But wherever we didn't have opportunity to identify female health extension workers, who graduated, completed high school, obviously we went for men. But now the issue is, to consider also culture, because it's very important that communities, accept them very well and have trust on them. So with that approach, the community health workers were identified, trained, and then deployed at community level. So basically it's in the household, meaning working with the mother, how, the environmental hygiene, the sanitation, the nutrition, because they have all the raw materials in their backyard, but then they never knew, this has got good nutrition, source of minerals, so that they can address, the malnutrition among children. So that was one, meaning it was a government and community, working together. So it's not a provider-receiver model, but all communities at household level were part of that national program. That is one. Secondly, they were not volunteers, but they were paid. They were on salary from day one. So the government committed, now this is my role. But obviously, the partnership workers. So partnership came and then brought in best practices from elsewhere, because we don't need to reinvent the wheel, right? If something is working elsewhere, of course, we need to customize, adopt it, but, we should be able to use it so that we can leapfrog and indeed transform, the health service delivery. So I think those were some of the experiences from Ethiopia. And I believe even in Kenya, now the community health volunteers are providing services at community level, because it would be very difficult for any country to train high-level cadres and then deploy to all levels, because we know there are lots of inequalities. As Collins was describing earlier, you go to certain facilities and you find only one person doing everything, including data collection, which will now be a challenge even to track where is the country in terms of achieving, the SDGs and so on. So I think it's very important to involve communities, meaning they are part of it and they own it, and then they support. Because when we say SDG, it's not for government only, it's for any individual. Like Gladys was also describing, what can I really do to transform my community? So who is being left behind? Then how can I make sure that, I track those who are not accessing services, and then make sure that they are part of, that success. So that has been the experience. And I believe even Kenya is doing, the right thing, so that communities are also involved in designing, planning, implementing the healthcare delivery system in Kenya.
Okay. And how much of an investment did you have to make? Because I know as a number of African countries committed to dedicate, is it 15% of the
Abuja, yes.
the Abuja Declaration? But many of them fall far below that. So when you're, I know the Ethiopia situation has been put up as a model for what has worked. Is it something that is capital intensive?
I don't think so. In fact, the Abuja Declaration itself, we always say that, countries have not really met, that allocation. But I think the tool itself has to also be revisited. Like, what is government contributing? Maybe, the infrastructure that is being put up, the training of care providers, and, the number of things, that is being invested need to be also taken into account for that matter. When we say, 50, not only the annual, the cash, allocation. But when it comes to, the Ethiopian model, it hasn't really been that, capital intensive. So as I said, first of all, it is community owned, with the participation of the community. Let me just give one example. For example, the putting up the health post was done entirely by community. So government has not even invested a penny in putting up the health post itself, okay? So the responsibility of the government from the National Treasury was basically to put the health extension workers on the payroll. And unfortunately, let me say in Ethiopia, the payments are very, very low. So you will laugh if I tell you, like a GP, maybe $200, the monthly, but that is a country standard, okay?
Yeah.
So what I'm trying to say is, it has never been really, a big investment, but it's, I think, the political commitment and then providing, services to people, because that's how we can indeed reverse the mortality, the maternal mortality, the child mortality, name the malaria, HIV epidemic, and all of that. Because with that, in fact, the return has been very high. When you compare the little investment that you put on that system, and then if you didn't do that, then you have, the pipe open, meaning, people needing treatment services, which would cost a lot more. So it's very important to really invest in a strategic area to address, some of the critical issues that would at a later stage, cost the government and the nation, very big. So that has been the case.